Hi, my name is Musculoskeletal, student number 166535237. So today I am a nurse and I'll be conducting a neurological and musculoskeletal assessment. Let's do first the 360 inside the room. Okay, let's start. Perform hand hygiene, check for any contact precaution, close the curtain to provide the client's privacy and dignity. Hi, good morning. I'm Cherry and I'll be your nurse for today. For the confirmation, can you state your full name and date of birth?
Krisha, January 1, 2000.
Okay, as per doctor's order, I'll be conducting a neurological and musculoskeletal assessment. Would that be okay?
Yes.
Before we proceed, I have a few questions for you. Do you know where are you right now?
I'm in the emergency room.
Okay, you know what day today?
March 27, 2025.
Okay, thank you. Do you experience any frequent headache, neck pain, back pains, or
No.
joint pains?
No.
Do you have any family history of seizures, tremors, or involuntary muscle movements?
No.
Have you experienced any fractures or falls?
No.
Are you taking any medications?
No.
Okay, so the patient is alert and oriented to date and place. She's well groomed and no odors noted. Her posture is upright, no signs of deformities. She speaks clearly and accurately, no signs of facial drooping and no slurred speech. Can you walk back and forth for me, please? Do you have any pain, discomfort? And I'm checking the spinal cord bend for me. Okay, thank you. So the patient walks properly and with steady gait, no signs of pain and deformities, and spinal is aligned, no signs of scoliosis, kyphosis, and lordosis. So let's proceed with the cranial nerves assessment, starting with the cranial nerve 3, oculomotor, cranial nerve 4, trochlear, and cranial nerve 6, abducens. Follow my fingers without moving your head. You have any pain?
No.
Okay. And I'll be checking your papillary reaction. Okay. So the patient can move her eyes freely without any pain and discomfort. Pupils are equal and reactive to light and accommodation. Therefore, cranial nerves 3, 4, and 6 are intact. Let's proceed with the cranial nerve 5, which is the trigeminal nerve. Close your eyes and tell me where you can feel the sensation.
Forehead. Chin. Left cheek. Right cheek.
Okay, open your eyes, clench your teeth, and open your. Okay, close it. Do you have any pain?
No.
Okay, so the patient is able to open and close her mouth without any pain and discomfort, and she can feel the sensation. Therefore, cranial nerve 5 is intact. Let's move to the cranial nerve 7, which is the facial nerve. Can you smell for me? Show me your teeth. Close your eyes tightly. Raise your eyebrows. Okay. The patient is able to do so. Therefore, cranial nerve 7 is intact. So let's proceed with the cranial nerve 8, which is the vestibulocochlear nerve. Can you cover your right ear and repeat what I say?
Philippines.
Okay, the other one.
Canada.
So the patient is able to repeat my words. Therefore, cranial nerve 8 is intact. Let's proceed with the cranial nerves 9, 10, and 12, which is the glossopharyngeal, vagus, and hypoglossal. Can you open your mouth and say ah?
Ah.
One more? Okay. Can you move your tongue upward, downward, side to side, and repeat my word? Light night dynamite.
Light night dynamite.
So the patient can move her tongue freely with no pain and discomfort. Ovula is symmetrical, and she can repeat my words. Therefore, cranial nerves 9, 10, and 12 are intact. Let's proceed to the cranial nerve 11, which is the accessory muscle. Can you move your head downward, upward, side? Any pain?
No.
Shoulders up on the left, right, against the resistance, that one. Okay, so the patient can freely move her head and shoulders without any pain and discomfort, and resistance of head and shoulders with 5+. Therefore, the cranial nerve 11 is intact. So let's proceed with the upper extremity assessment along with the range of motion. The color of the skin is appropriate with the patient's ethnicity. It's warm to touch. Do you feel this?
Yes.
No abnormal sensations, no bruises, no lesions. There is tattoo noted, no scars. Just put it down. Can you move your hand, right hand, left hand? Movement is okay. And against the resistance. Okay, hand grip. One more. Okay. Upper extremity strength and resistance is 5+, both equal and bilateral. And capillary refill is less than 3 seconds. Okay, so let's proceed with the neck range of motion. Can you bend your head downwards? That's flexion. Upward, that's extension. Tilt your head side to side. That's lateral flexion. And rotate your head left to right. That's rotation. Do you have any pain for that?
No.
Okay, so let's proceed with the shoulders and elbows. Can you put your arms away from your body? That's extension towards your body. That's flexion. Can you rotate your shoulders inward? That's internal rotation, and outward. That's external rotation. Can you move your arm away from your body? That's abduction, and towards your body, adduction to the other one, abduction, adduction. And can you strengthen your arm and put a circular motion? That's circumduction. And put your palms down. That's pronation, and up. That's supination. Do you have any pain for that?
No.
Okay. So let's proceed with the wrist. Put your hand like this and put your fingers down. That's flexion. Up, extension. Put your fingers towards your thumb. That's ulnar deviation. And to the pinky finger, that's for the thumb, that's radial deviation. Can you repeat it again? That's radial deviation. And to your pinky finger, that ulnar deviation. Do you have any pain?
No.
Okay. So let's proceed with the lower extremities. Can you lie down for me? So lower extremities, color is appropriate for the patient's ethnicity. It's warm to touch. Do you feel this?
Yes.
So there's no abnormal sensation, no lesions, no bruises, and no edema noted. The capillary refill is less than 3 seconds. Can you move your left leg, right leg? Movement is okay. So let's proceed with the hip and knee range of motion. Can you put your right leg towards your chest? This is flexion, backward is extension. Can you do it on the other side? Flexion, extension. And put your legs outward. That's abduction, and inward, adduction. The other one, abduction, adduction. Can you bend your knee to 90 degrees and put your legs inward? This is external rotation, and upward, internal rotation. Can you do yourself? Okay, this is external rotation and internal rotation. Okay, so let's proceed with the ankle range of motion. Can you put your toes towards your nose? That's dorsiflexion, and downwards, plantar flexion again. Again, the resistance. Okay, so lower extremity resistance is 5+, both equal and bilateral. And the findings for the range of motion in both upper and lower extremities is full and active with score of 5 out of 5, and both equal and bilateral. That concludes my presentation. Let's do the 360.